We have been following this population in their homes for something like 15 years. Over time, we're getting larger and larger numbers of people successfully treated for HIV, and it is very likely that a whole range of other diseases are likely to start to come to the fore. And these include hypertension, high blood pressure, and also diabetes. Vukuzazi is a really innovative research program that we're just launching at the Africa Health Research Institute. In isiZulu, it stands for Wake Up and Know Yourself. It is a way that we are bringing next generation of health research to a population platform that AHRI has been running for the last 15 years. One of the key aspects of Vukuzazi that will push this research agenda forward is understanding about the genetic makeup of our population, but in particular, what is it about those genetics which determines who is protected from disease or who gets disease.
The relationship that AHRI have with the community of this district, Umkhanyawute district, is very good because of the work that AHRI is doing for the people of this area.
What's quite unique about Vukuzazi is that many of the people who come will have been visited in their homes, and things that have happened to them, births and deaths in their household, the socioeconomic conditions of their household may be well known to AHRI. We've organized the layout of the camps over the course of the 18 months so that you shouldn't have to go more than a kilometre from your home when it's your day for screening. Since we're enrolling over 30,000 people over the course of Vukuzazi, all aspects of the Vukuzazi platform have to function seamlessly. Vukuzazi has a very cool data system that starts in the field where participants get a bracelet when they consent that's their unique identifier, and every time they give a sample or give a piece of information, that bracelet gets scanned. The platform's been designed to screen participants for diabetes, high blood pressure, nutritional status, meaning obesity, malnutrition, tobacco and alcohol use, as well as HIV and tuberculosis. Our clinical team is able to look at all the information, link it together, and make referrals appropriately.
It offers them an opportunity to actually know their disease profile. It's not just about screening, it offers them an opportunity to enter the healthcare system because we have a referral pathway that has been arranged with the Department of Health, and we actually also have nurses present at all the clinics where Vukuzazi will be operating. So there is a direct pathway from screening to actual management of the disease if the disease is present.
Capturing these high-quality digital chest X-rays and all the information that they contain, and then using our laboratories to analyze the circulating strains of TB is going to take our understanding of TB transmission in the community to the next level. Putting all of that information on top of all the rest of the health data from Vukuzazi will create a completely novel, integrated set of information and biosamples. And this will let us really start to understand the fundamental interactions between HIV, diabetes, tuberculosis within the individual and within the whole population. So we want to know an individual, but more importantly, we also want to know the whole community's state of health and disease, and which diseases are impacting and causing morbidity and mortality in the community.
There's a paucity of data from Africa, sub-Saharan Africa, and I think we want to redress that balance. We want to ensure that the potential benefits that are being shown to populations in the West can also be provided to the population here. And of course, a prerequisite for that is to understand the genetic makeup of this particular population that we're studying.
To the best of my knowledge, nowhere in the world would you find that you have these many years of data that we've collected from the population studies, now link that data with the clinical data that we have.
As we know, many diseases are multifactorial in etiology, in cause, the environment and the genetics. There are very few places that can pool these data together and understand those diseases. This is the opportunity we have.